So you've had this persistent cough going on for a few weeks or maybe a few months, and you want to know, how do I get rid of my persistent cough? So it could be a dry cough, or maybe you're producing lots of mucus, especially in the mornings. And the most common cause of a persistent cough is allergies. So allergies can usually be triggered by the environment or pets, cats, dogs, pollen, but this can trigger a chronic state where basically you have constant production of mucus. Now, a lot of people will say, Doctor, I've got a dry cough because I'm not producing any mucus, but you do not actually have a dry cough. It's just that the mucus is so thick that you're not able to expectorate the mucus, which gives it the impression that you have got a dry cough. Now, you might say, Doctor, I've tried all different over-the-counter remedies. I've tried honey, I've tried ginger, lemon, cough syrups, nothing has worked. Now, you have to understand the process of allergies. These medications are not going to work for your cough is because of the allergy. Now, with allergies, you have, all these chemicals like the mast cells, your eosonophils, your basophils, IgE, and they all create this inflammatory response within the body. So your mast cells, for example, will lead to the production of histamines, which will propagate the cough by causing increased production of mucus within your system. And if you think about your upper airways, you've got your nasal passages, you've got your sinuses. So this increased production of mucus and inflammation propagated by these mast cells, your eosonophils and your basophils, will lead to the chronic, constant production of mucus, where basically it's non-stop. You might also notice that you've got a constant runny nose, or you feel stuffed or block your nose. So we have two situations here. We've got the allergy aspect of it, then we've got the chronic aspect of it known as the postnasal drip. Now with postnasal drip, especially happens at night time when you're lying in bed, you have constant production of this mucus from the airways going down to the back of your throat and into your upper chest, where basically you can feel this mucus sensation, but you're not able to bring out any mucus from the chest. It is quite hard to cough it up. So in terms of medication, the best remedy would be taking antihistamines. Now, antihistamines is what's going to stop the production of the histamine. And so by stopping the production of the histamine, the antihistamines then serve to drop the mucus. Now, you're not going to notice any noticeable difference after maybe 2 or 3 days of taking antihistamines. This might take, at least 2 to 3 weeks before you start seeing a significant reduction in the production of the mucus. Now, antihistamines include your cetirizines and your loratadine. So if you're going to take cetirizine, for instance, for adults, it's a 10 milligram dose tablet taken once a day. If you do have severe symptoms, which are worse in the evenings, you can actually take a 10 milligram dose in the morning and a 10 milligram dose in the evening. Now, these are non-drowsy antihistamines that do not make you sleepy, but some people might get sleepy as a side effect of the antihistamines. So you might take 10 milligrams twice a day, maybe initially for a week, and then after a week, as your symptoms improve, you can reduce to cetirizine 10 milligrams once a day. Another alternative to cetirizine is loratadine, which is another 10 milligram tablet that you can take once or twice a day. Similar to cetirizine, you can reduce to once a day. I would avoid Piriton, which is usually taken 3 or 4 times a day. Piriton is short acting and it can definitely make you drowsy, especially if you have to drive or work. Whereas your cetirizine or your loratadines are more long acting medications that you can take once a day. So to help with your postnasal drip and your allergies, taking an antihistamine, cetirizine or loratadine 10 milligrams once or twice a day would be my recommendation. You can take this for a few weeks. If after a few weeks you notice that your symptoms are not better, it could be that you need to add other medications such as a steroid spray. For instance, a steroid spray such as Nasonex, Flixenase, Avamis would also help to reduce the underlying inflammation in your sinuses that is causing the constant production of the mucus. While taking the cetirizine, which dries up the mucus, you're taking the steroid spray, which reduces the inflammation that causes the mucus. So you might find that taking the steroid spray alongside your antihistamine tablet is more effective than taking just the antihistamine on its own. Also, you want to make sure that sometimes you have all this pollen and all this debris in your nasal passages. So despite taking the cetirizine and the steroid spray, you're still having the symptoms. So what you need to do is you need to irrigate and clean up your nasal passages and your sinuses. So you might want to take a salt water spray, such as Sterimar spray, for instance, or sinus rinse. So these contain natural sea salt water that help to irrigate and clean out your sinuses, which allows the medication to work. If after all this, you've tried the sinus sprays, you've tried the steroid sprays, you've tried the antihistamine, nothing's helping, now is the time to see your doctor. Now, I hope you've enjoyed this video. Please feel free to like, share, and subscribe.